Hey everyone, Justin Jolene here with another issue of the Running Specialist Report. And today we're going to talk about what's new with patellar tendinopathy treatment. Now, many of us are familiar with recommendations to prescribe eccentric exercises like decline single leg squats for patellar tendinopathy. But here's the problem. And that is that those decline single leg squats actually put a lot of pressure and stress and load on the patellar tendon. And what this causes is inflammation. It causes a lot of stress, which is going to inhibit healing. And unfortunately, it can hinder recovery. So what do we find as a new approach that's going to help to recover these patellar tendinopathy patients? Well, it really gets down to progressive tendon loading exercises. Those are the most effective, and that's what some of the new research has said is that that's what's going to benefit patients the most and get them better. So what is progressive tendon loading exercises? Well, on a fundamental level, it's going to be gradually stressing the patellar tendon in this case to build progressive load tolerance in the tissue. And what that's going to do is it's going to gradually allow the patient to do more and more, to put more and more load on the patellar tendon. Now, what we're finding is that those exercises don't really matter which type of contraction they're actually using. So they can be isometric, they can be eccentric. All it's saying is that it wants to grade these corrective exercises or these interventions from a lower amount of stress to a higher amount of stress. So it's really important for clinicians to understand that there's 3 tiers of exercises: low, intermediate, and high patellar loads that we can use for patients. And one of the important things to understand is the patellar load index. Now, first, let's talk about the clinical pearls, because I want to make sure you know these big bullet points so that you can make this impact with patients coming up. And that is that progressive tendon loading exercises are more effective than isolated eccentric loading exercises, especially in the treatment of patellar tendinopathy. And patellar tendon loading peak, impulse, and rate is what's going to consider or make up the loading index. That's another really important part that we'll talk about. The low step up is the least amount of stress in these exercises for patients, and a single leg decline squat is actually the highest amount of load. And then lastly, as we compare patellar tendinopathy to other treatments, and when we compare corrective exercises to other treatments, we are going to look at things like PRP injections and even things like soft tissue treatment. And what we're going to find is that PRP is the next progression that oftentimes would be used. It's very effective in treating patellar tendinopathy, especially for those chronic patients, but we only use that if conservative measures fail first. So let's dive into some of this content. So first off, as I mentioned before, let's talk about what the patellar load index is. And that's going to be basically an index that's going to consist of the loading peak, impulse, and rate. So the loading peak is going to be the peak amount of load placed on the tendon. So during an exercise, if you see load, you're going to basically see the peak amount of load is the highest point, the most point of load placed on the tendon. The loading rate, on the other hand, is going to be the speed at which load is applied. Think of plyometrics are going to apply load quite quickly, actually. And then the load impulse is the total amount of time spent loading that tendon. So maybe you're doing a really, really slow single leg squat. That might be a lot of overall loading impulse because you're doing that exercise for a long time. So in the beginning phases of patellar tendinopathy rehab, we want clinicians to prioritize exercises based on the loading peak and impulse. Those are going to be things that are going to, you want to overall keep that peak generally low. You want to keep the total time pretty low as well, but the loading rate isn't going to matter as much because we want it to be, while a little bit slower, we also don't care if it's a little bit slower or faster because these exercises are going to be more based on the total time spent and how high the peak goes. It's going to impact these patients the most. However, as we progress these patients, we're then going to see in the advanced stages of rehab, we want them to more think about the loading rate because we want to apply that load quickly. So it's going to then basically stress the tendon at a more quick pace, exactly like you would in a sports or running setting. So to help us better understand which corrective exercises to give patients, there's a number of ways we can do this. And right here, I'm including a link in the PDF to be able to have a resource that can help rank the exercises. That's a nice Excel spreadsheet you can use. But this infographic is another really good one. And we can see down here, we have tier 1 in the middle, tier 2, and tier 3. Tier 3 is going to be the hardest. So we can see down here at tier 1, we have things like a double leg squat to 60 degrees. We also can see we have a low step down and we have a low step up. And then in our middle tier here, I want to also look at one that's really important, which is going to be the Spanish squat. And for those of you who don't know what this is, here's a video or a picture of it, right here. And also you can find a lot of good resources. If you have questions on what that is, let me know. I'll send you some good tutorials on it. As we go a little higher, we can see there's a couple other things. In tier 2, we actually still have plyometrics as part of our corrective exercises. And that's because plyometrics, while they do add stress, they don't add as much stress as we might think. But really what's going to put the most stress on that tendon is going to be, especially in the sagittal plane, that straightforward plane, it's going to be your single leg decline squat. That's going to be the most. We can also see things in here like a single leg maximal forward hop as well is quite high on the patellar loading index. So what are some of our useful tips and things we want to consider? We talked about the Spanish squat already. It's emerged. It's particularly useful because not only does it have a low barrier to entry, it doesn't require gym equipment or anything like that. It also does stress that patellar tendon, but not overly stress it. So this is one of those that's coming up as a really good gold standard. One of the things, the go-to exercises for PTs and other rehab professionals when they're getting a patellar tendon back and loading it up. Also, we're going to see in the initial phases of rehab, we definitely see lower patellar tendon loading exercises like the Bulgarian squats, sumo squats, double leg, and single leg squats are important. But of note, it's important to talk about that the double leg squats to single leg squats should be progressed before progressing from 60 degrees to a full squat. So you'd actually want to go double leg, single leg, all at 60 degrees, and then go double leg full squat and a single leg full squat as well. That would be your progression. Again, as I mentioned before, the jumping and landing exercises actually do generate moderate loads on the patellar tendon, but not as high as many of us think. This is tier 2. This isn't tier 3. And therefore, we should introduce these a little bit earlier in the intermediate stage of rehab because it's going to help us get back and put more load so we can eventually get to that higher level, tier 3, which is going to help us get back to other exercises and sport. And then lastly here, clinicians should also keep in mind that patellar tendon loading and force is influenced by the trunk position as well. So a forward trunk lean or increased trunk flexion is going to reduce the amount of patellar tendon stress, and then more upright trunk or decreased trunk flexion is also going to increase the load. So we can use that to modulate and progressively add more load over time as well. But you might be asking yourself, well, that's great, all this information about corrective exercises and therapeutic exercise when it comes to patellar tendon loading and patellar tendon rehab. What about all these other exercises that are out there? And there's a number of different other treatment options that are out there. And that includes things like PRP injections, platelet-rich plasma injections, cortisone injections. It even includes shockwave therapy. So what's the latest research on that? Well, evidence definitely supports progressive tendon loading exercises as the first treatment for patients with patellar tendinopathy. However, there's a lot of other viable options out there, and I talked about before, platelet-rich plasma injections is the other gold standard. If conservative measures like PT fail, we are then going to progress to PRP, maybe provide that patient a referral or send them back to their primary care to be able to understand where to go for that PRP injection. It's one of the best treatment options, and it has really good success rates. The patellar tendinopathy patients might need multiple injections in case it is chronic, but this can be a really good option. Cortisone injections, unfortunately, aren't really supported by the research that much anymore. They do provide some short-term relief. However, in the long term, they are usually seeing worse outcomes. They're having degeneration of the tissue that's injected and not proven really to be a long-term effective care option. Cryotherapy, short-term benefits for pain relief. Unfortunately, it is not indicated to do high-intensity exercise right after doing cryotherapy. So use caution. Again, it's not going to be a lot of downside. It just might provide short-term relief at best. NSAIDs is a little controversial. There's some mixed outcomes, and there's definitely some differences out there on using NSAIDs. Some studies show that the benefits are to decrease the tissue inflammation, whereas others say that NSAIDs are going to prevent the healing growth and healing tissue. So they definitely help with short-term relief, but they might hinder progress in the end. Extracorporeal shockwave therapy or shockwave therapy. We went over this in more detail with shockwave therapy for athletes and for runners, but shockwave has proven to be a intervention a lot of people will use, and it doesn't have a lot of downsides. The problem is it has been widely researched, and there is still lacking evidence for its effectiveness, and it's still fairly inconclusive whether it is actually beneficial for patients. Dry needling, many PTs will do dry needling. This is something that is an effective treatment option for patellar tendinopathy. Its current recommendations are to perform dry needling in conjunction with progressive tendon loading, so we wouldn't want to do those things isolated. Also, patellar tendon taping and bracing can also be great short-term pain relief, and there's some research out there that's going to say it's going to decrease the patellar load during those exercises and activities. That's then going to help to overall keep inflammation levels low with recovery. The problem that we know is that we want to progressively stress the tendon and get it stronger and stronger. So if we are using a patellar tape or brace, unfortunately, we may not get that tensile strength, and it might just help to decrease the overall amount of stress to the tendon without actually progressing it on the road to recovery. Manual therapy can be helpful. It's a short-term relief option most of the time. Some cross-friction massage and other therapies can be useful. Again, mainly short-term benefits. And then lastly, if all else fails, all other conservative measures fail, there is surgery out there. And there is obviously a lot of controversy on getting in there and doing surgery, and this would be a bigger conversation with an orthopedic surgeon. However, we would say here that post-surgical, the outcomes are really good. Arthroscopic are at 91% success, and open is at 87% success rate. So these can be very viable interventions, but we want to be careful, and we want to certainly fail other therapies first. So take this information when you're treating your next patellar tendinopathy patient or runner. These can definitely be helpful things to keep in mind. Check out all the resources down here, and there's a ton of new research out there on this. If you have any questions, let me know. Otherwise, I'll see you next time.